So are we starting, Dr. Aarti?
Yeah, let's start.
Yeah, because we'll share the recording with other participants. I don't think they might just join in late.
Yeah.
Okay. So first of all, welcome you all. My name is Dr. Niti. Today I'll be discussing few tips and tricks about how to defeat the mouth monsters. Before that, before jumping directly to the tips and tricks, first we will be knowing why the tooth monsters occur in the mouth, first of all. Okay. First, we will be talking about how you identify a cavity, when to visit a doctor, what are the home precautions you need to take, and then whatever doubts you have, which you had mentioned in the form, we'll be discussing those. Okay. So like you all, there are other few parents who had mentioned about their doubts, so I've summarized all the question together so that all the doubts are cleared today. Okay. So ma'am, can you just change the slide? Little technical error because I got stuck with one of the case. I am out and Dr. Aarti will be handling the presentation for me. So please excuse us if you find any kind of delay with the presentation. Okay. So firstly, can you see these three pictures? If you clearly identify the first picture, there are some white spots on the picture. So when you as mothers or you as kids, when they complain to you that there are white spots present on the teeth, you usually say they are white, so they might not be cavities. So you tend to ignore them. Let me tell you, a cavity is a long tooth decay is a very long process. It doesn't start overnight, and doesn't a black tooth appears suddenly. So it starts with those white lesions, which are nothing but incipient lesions. So incipient lesions are basically the start of the cavity. These white lesions are basically determine the texture of the tooth, the texture of your enamel. Enamel is the outer coating of the tooth. So if you have this white incipient lesions present on the tooth, you need to immediately visit your dentist, because if not taken proper precaution or preventive measures at this stage, your teeth will go into further cavitation, like I'll show you in the next picture. You will be coming to the dentist with ma'am, can you change the slide? Change the slide. You will be coming, if you ignore these white lesions, you will be coming with these cavities. Can you see how badly the front teeth are cavitated? You usually visit the dentist when you see those black spots on your teeth, not when you see those white spots on your teeth. So you need to visit the dentist as soon as you see those white spots on the teeth, because those white spots are nothing but the initial cavity lesions. Okay, these provoke and transform your teeth into this black decays. Ma'am, next slide. So what are the causes of cavities? Why do you think usually these white structures appear on the teeth? Why do you think your teeth turn out black? So there are multiple reasons. Cavity is not something which happens because of one particular reason. My child eats a lot of chocolate, that's why he has cavity. It might be one of the reason, but it's not the only reason. My child doesn't eat sweet, but still he has a lot of cavity. What can be the reason? People say sweets khane se hi sirf cavity hota hai. It's nothing like that. There are multiple reasons why cavities occur. So we'll go through each and every reason one by one. So as I mentioned, cavity is a factorial this thing. The first is vertical transmission. Now you must be thinking this is a very medical term. What is a vertical transmission? So basically, a mother can transfer cavities to the child by through saliva or through placental connection. Placental connection, as in if the mother is very prone to cavities during her childhood or during her pregnancy, she is prone to transfer the bacteria which causes cavities to the child. And when the child is born, you see teeth आते ही cavities दिखना start करते हैं. That can be one of the reasons. So the bacteria which cause the cavity can be transferred from the mother to the child. Infection. So the first 4 years of a child's life is very crucial. Okay, any kind of infection happening in the first 4 years of child's life should be always noted and reported to the dentist when you visit them, because suppose, for an example, if your child suffers from pneumonia or suffers from jaundice as soon as your child is born, all these things will allow your child to take antibiotics. So antibiotics always interfere with the tooth development. So when your tooth is developing, when the calcium in between the teeth are binding together, the antibiotic which your kid is taking will affect the binding of the calcium together, causing disruption during the eruption. So so what will happen? You will see the white lesions. This white lesions on the teeth is nothing but the soft, or the, what you can say, the delicate structure of the teeth. So whenever there is other acid attack while eating, or sugar substance attack on your tooth, the the first surface of on your tooth which will be affected will be uh, which will be the brittle structure. So you need to report about all the infections which your child had when he was during his first 4 years of life. Okay, that needs to be considered. Then feeding practices, as we all know, as our Indian Society of Pediatrics have been recommended that you should be breastfeeding your child uh, from 6 months on, from 6 months to 2 years of age. Okay, so why that 2 years of age is there? Like people say कि 2 साल तक बच्चे को feed करना, is it good? Because I'm seeing cavities are being developed. Is it because of feeding? Is it because of prolonged feeding at night? What is the reason? See, I am not saying no to feeding. Obviously, your child needs to get the nutrition right from the mother's milk, but make sure that along with the feeding practices, you also inculcate teeth cleaning practices for your teeth, for your child. So if your child is less than 6 months of age, there are no teeth, what will you clean? You clean the gums, because the milk discharge stays on the gums. So when your new teeth starts erupting, this discharge which is there on the gums will adhere to the teeth, because all this discharge, once they start adhering to the teeth, and if the teeth are not clean, they will move into cavity. So feeding practices should be followed till 2 years of age. Post 2 years of age, you should manipulate your feeding habits, as you should not feed the child at night. You can do breastfeeding during the morning time. During the night time, if you're feeding the child, make sure you feed the child, then clean the mouth of the child, and then make your child sleep. Don't make your child sleep with the bottle or milk in the mouth, because such habits will do nothing but spoil the teeth more. Because see, milk is nothing but lactic acid. Too much of acid attack on the teeth are going to spoil the teeth. Next are habits. Habits not only means see, here habits particularly means the eating habits. So a child will always want to eat sweets, or want to always grab on chips, or maybe something which is unhealthy. As a pedodontist, I never say please say no for eating this to the child. Please say no for eating that to the child. But I would recommend, if your child is eating unhealthy food, make sure there is a pattern of your child eating those. I recommend you to give chocolates to your kids during the lunchtime. During the lunchtime, as in have a proper lunch, have your chocolates as a dessert, and after 2 hours, have nothing, have directly snacks. In between your meals, you should not have snacks. Like if your child is having breakfast at 10 and your child is having lunch at 1, make sure between 10 to 1 your child is having nothing. If your child feels like eating anything in between, make sure you give healthy foods, like you give fruits, or maybe you give juices. But make sure even after giving fruits or fruit juices, you ask your child to gargle well. Okay, please stop snacking in between the meals. And if your child is asking for too many biscuits or chips during the in between part, make sure you make a time for them during the evening snacks. With tea, you can give them this unhealthy snacks, but make sure unhealthy snacks are lesser in quantity so that it's better for your child. Now, medical conditions. What do I mean by medical conditions? Basically, if the mother is suffering from any kind of illness during pregnancy, it cannot be ignored, because if the mother is taking any kind of antibiotic because of any kind of illness during pregnancy, antibiotics do transfer from placenta to the child, creating interference in the development of the teeth, as mentioned earlier. So you need to make a note of all the medical conditions or all the medical problems the mother is you as mother is going through during the pregnancy. And also, if any medical condition, even a small fever, even a slight 4-day fever, if your child is if your child has immediately after delivery, make sure you mention it to your dentist, because these all things help us to identify the reason why the teeth has been cavitated so badly. S mutans is a term. Basically, it's a bacteria which basically is more um, responsible for the teeth to have cavities. Okay, so it's nothing but it's a bacteria which causes cavity. So we need to be little aware of this term. That's it. So as I mentioned, all these factors, okay, your child might have two of these factors, three of these factors, or maybe even one of these factors, or there can be multiple reasons why your child is having cavities. There is never one particular reason why your child is having cavity. So make sure when your doctor is asking you about certain questions while meeting you for the first time, do answer them truthfully, so that it's easier for the doctor to understand why your child is having so many cavities, and easier for the doctor to explain you why your child is having so much trouble with the teeth. So this is most common question which is asked to me as a pedodontist, is that is it really necessary to treat milk teeth? They are anyways going to fall, because when we were children, we never really faced so many dental problems, you know. So nowadays, as a parent, when we see our child's teeth, we see a lot of problems in them, and then this question arises. So let me tell you, firstly, when we were kids, we also had dental problems. The only thing is we never noticed it, because that time there was no pedodontist to address the problems. Our parents used to take us to a general dentist who used to just claim that कि ये मेरे दूध के दांत है, ये तो गिरने वाले, इनको ट्रीटमेंट की जरूरत नहीं है. So we also had dental problems. The only thing is that the awareness in nowadays is increased as compared to what it was in past. Now coming to the question, is it necessary to treat milk teeth? Dr. Arti, next slide, please. So basically, milk teeth play a very important role in a child's oral and general health. Oral and general health, as in, if your child is eating healthy, your child gets all the nutrients properly, and if your child is getting all the nutrients properly, your child is healthy overall. So the first teeth in a child's mouth start coming up somewhere between 5 months to 6 months of age. Okay, I'm giving a range because in some kids it's come early, some kids it's come late. So around 5 to 7 months of age, your first tooth starts erupting. The eruption of the milk teeth continue up till 3 years of age, and from 3 years of age to 12 years of age, your milk teeth are present in the mouth. Okay, your milk teeth, especially your milk molars, are present in the mouth. So if you don't really take care of those milk tooth, your teeth can be decayed really bad. Like I'll show you the following pictures where you can see how badly the teeth are decayed. See, these are all decayed milk teeth. So if you don't take care of your milk teeth at an early age,
ते मीटिंग चालू है.
okay, so if you don't take care of all the milk teeth will be decayed in such a manner, and these decayed milk teeth can lead to oral infection, can lead to pus formation, can lead to drastic pain, which might lead to discomfort in eating, in talking. Plus, don't forget, your milk teeth, below your milk teeth lie your permanent teeth. So if your milk teeth get infected, the infection will go below your milk teeth, and they will infect even your permanent teeth. So it is really important to treat the milk teeth so that your child eats better and your child's overall health is better. So next question, which is most commonly asked to me, is when will my child's milk teeth fall and the permanent teeth will grow? So there is a small eruption pattern which I would like to tell you. Next slide, Dr. Arti. Okay, so as I told you earlier, your first milk teeth start erupting by the age of 6 months to 7 months. So once your milk teeth starts erupting, the eruption of the milk teeth continue up till 3 years of age. So a child has all his milk teeth, all his 20 teeth, 10 teeth in the lower arch, 10 teeth in the upper arch by the age of 3 years. Okay, when your child till the age of 5 years, this teeth set remains constant. Okay, there is no change in the teeth set. Your child has a complete set of 20 teeth, 20 in the 10 in the upper arch and 10 in the lower arch. Can you just show the next picture? Yeah. So when your child is somewhere between 5 years to 7 years of age, your child will have the first permanent molar will start erupting. The first permanent molar starts erupting without any teeth falling. I have done the markings. Ma'am, just click once again. Yeah. Can you see those circles marked? Those are your first permanent molars. These permanent molars start erupting in the mouth by the age of 5 to 7 years. I'm repeating again, I am giving a range of teeth eruption. Reason because some children have early eruption, some children have little delayed eruption. So your teeth can come anywhere in between this range. If your teeth doesn't erupt in the mouth anywhere in between the range, then it is of concern and you should surely visit your dentist to know why the eruption is not happening. Okay, so firstly, your first permanent molar will start erupting by the age of somewhere 5 to 7 years. When your permanent molars are erupting, simultaneously your lower front teeth will fall off and new permanent teeth will come in place. Okay, when your lower teeth are falling and new permanent teeth are coming, simultaneously your upper front permanent teeth erupt in the mouth. Yeah, can you see there is one permanent teeth missing? So that will fall off and your permanent front teeth will start erupting. So this will happen somewhere in between 6 to 8 years of age. Both the upper and the lower front teeth will start erupting between 6 to 8 years of age. So once your child is complete 8 years of age, at around somewhere between 8 to 10 years, your child will have mixed set of teeth in the mouth. Mixed set of teeth, as in four permanent molars, one corner each, one on the lower left, one on the lower right, one in the upper right, and one in the upper left. Okay, there will be four permanent molars in all the four corners. There will be four front anterior teeth, that is in your lower arch, 1, 2, 3, 4. Then your four in your upper arch, 1, 2, 3, 4. And in between all these permanent teeth, right from your canine to your second last teeth, will be your milk molars. Okay, the last two to fall in the mouth is the upper canine, which is also yeah, upper canines. Ma'am, can you just click one more time? I have marked the upper canines. Okay, the upper canines are the last two to fall in the mouth, and they will fall somewhere around 13 years of age, 13 years onwards. So once your teeth, upper canines fall, and if you feel that you want to get your child's teeth straightened, then you can do and go to an orthodontist. So my job as a pedodontist ends at the 13 years of life of the kid, and then your child is a adult into the dental world, where you can show it to an adult dentist. Okay.
Dr. Neeti, here Ms. Shwetali ma'am had a question.
Yeah.
That her kids are 7 years old, na? So unka central incisor is not yet erupted.
Upper central incisors?
Yeah.
Okay. Shwetali ma'am, don't worry. Usually the upper central incisors take little time. They come up till by 8.5 years of age. But I would recommend you to just get a follow-up done, because you know sometimes delayed eruption is because of multiple reasons. कई बार क्या होता है, when you take an X-ray, you see there is an extra teeth inside the gums. In between your permanent teeth, which is actually causing problem for your permanent teeth to come down.
Okay.
Okay, it can happen. It
Dr.
doesn't happen every
had,
time.
Yeah, even Dr. Aarti had suggested to take an X-ray.
Yes, X-ray, yes. So once you take an X-ray, now we get to see the formation of the root कितना हुआ है, कितना root formation complete हुआ है. Suppose अगर आपका root formation complete हुआ है और आपका teeth फिर भी नीचे नहीं आया है, so there can be multiple reasons कि या तो there is no adequate space for your permanent teeth to come down, so we need to make little space for your permanent teeth to come down. maybe sometimes क्या होता है, the gum is so thick at that particular area that your teeth doesn't exert that much pressure on that area and it doesn't come down. So in such cases क्या करना पड़ता है, we just have to give a slit on the gum so that your teeth easily comes down without any problem. So you need to just get a visit done. If your x-ray is normal, if your gum thickness is normal, then don't worry, it will come by 8.5 years of age.
All right.
Yeah.
Thank you.
No problem. So at what age should I start brushing my child's teeth? This is another most common question asked by all the parents. And how do we brush? So ma'am, next slide please. So see, brushing firstly, brushing doesn't only happen when your child has teeth. It is supposed to start right after the birth. So because your child is on breastfeeding, there is this white discharge of the milk which gets stuck on the gums. So you have to start cleaning your baby's gums right after the birth with a clean and a soft cloth. You can use a muslin cloth, you can use a sterile normal soft cotton cloth which is supposed to be rolled around your finger. Just put your finger around and just clean it. I know your child is not gonna like what you're doing, but trust me, it is for their benefit, so it has to be done. Okay, so first tooth, make sure you're cleaning the tooth at least twice in the daytime. That's morning and the night. And once you clean the tooth, make sure your child is not on any kind of milk or any kind of other form of liquid, or any kind of or not practicing any eating habits after brushing. Okay, so for children who are less than 2 years of age, they should use a smear of toothpaste on their finger brush or maybe on their small baby brush. Make sure they're using a baby toothbrush, the baby toothbrush head is made up of rubber and not of plastic. I am saying this because when your kid is not cooperating well for brushing, and as a parent you're assisting your kid to brush, your kid might be little little what do you call not liking or maybe little aggressive while brushing. So if it's a rubber head brush, it will be easier for you to handle, and it will not cause any hurt to your kid while brushing. From 2 to 5 years of age, you can use a pea size toothpaste for your child on the toothbrush, and you can ask your child to brush. As a dentist, as a pedodontist, I would recommend that parents should assist the child in brushing till 6 years of age. Okay, I know a lot of kids don't like parents brushing their teeth because they feel that they are big enough to brush on their own, but you still have to do brushing for them. Make sure you brush their teeth well, and uske baad you can give them the brush without a toothpaste just for their fun, but make sure you brush. Okay, now there are many children who don't like brushing at all, and as a parent you must be having doubts ki how to assist my child in brushing. So the next slide will help you to understand how you can assist your child to brush. So there are various positions in which we can hold the child. You can hold the child in front of you, you can stand behind the child, you can retract the cheek of the child and do the brushing for the back teeth. You can raise the lip of your child and you can brush the front teeth. Make sure when you're brushing the teeth, you are not brushing it in a very aggressive manner. You're brushing in a slow circular manner, and it should be make a count like 1, 2, 3, 4, 5 in the lower left side, 1, 2, 3, 4, 5 in the lower right side. Again, similar for the upper quadrants and in for the front teeth. Okay, once you do that, then you ask your child to gargle thoroughly so that the full mouth is clean really well. The other position in which you can assist your child for brushing, if your child is too aggressive and is too stubborn for not allowing you to brush, both the parents can join hands together. They can make the child sleep like on each other's lap, and then they can do the brushing. I know it looks little scary as a parent, that you are doing a lot of restraining your kid for a simple process like brushing, but trust me, they will cry for few days few days as in 1-2 days, and once they understand that you as parents are not going to listen to them, but you are going to brush their teeth anyhow, they will give up and they will cooperate. Okay, because it's for their benefit, they will surely cooperate. Next slide, please. No, the previous. What toothpaste and tooth? Okay, the as I said, you have to lift up the lips and the cheeks with brushing. So there are various techniques where you can motivate your child to brush. Firstly, as I said, you can keep on counting the number of sides, so that when your kid is learning numbers, it's easy for them to even recollect the numbers, and it's make it playful for them. If not, you can tune into ABCD songs for your kid. There are brushing songs which are available on YouTube, which you can put it on. They are 1 minute, 1.5 minute songs, so that brushing happens in that particular time. Then you can reward your child every time after he or she brushes well. Reward as in, I'm not talking about a big gift. Don't pamper your child with all those give big gifts and all. I'm talking about small rewards. You remember how teachers give rewards to the kids on hand by drawing a star or something? You can do that for your kids. It's a very simple reward, but they do appreciate any kind of small reward also. So make sure you do that, so that it's easier for the kid to accept the brushing techniques what you are imposing on them. Next slide, please, ma'am. Okay, now the next big question: what toothpaste and toothbrush should I use for my kid? So, before choosing any kind of toothbrush or next slide, ma'am. Before choosing any kind of toothbrush or toothpaste for your kid, understand uh, understand what is the oral hygiene status of your kid. Now, what I mean by oral hygiene status is basically how prone your kid is to cavities. For that assessment, you need to visit the dentist as soon as your child's first tooth erupts. Okay, don't mark my words. First tooth eruption ke baad a dental visit is must. Okay, because looking at those two or four tiny teeth which are present in your child's mouth, we as dentists can easily tell you whether your child is very prone to cavities or not. Okay, if your child is very prone to cavity, then a fluoridated toothpaste should be started quite early. If your child is not that prone to the cavities, then a fluoridated toothpaste can be started after 3 years of age, once your child starts spitting properly. Okay, fluoridated toothpaste, when you're using, make sure you always take a doctor's recommendation before you use it. Okay, now there are many toothpaste which are available in the market. We are not going to promote any kind of brand. I have just mentioned a few which can be readily available for kids. So there are milk based non fluoridated tooth creams which I suggest if your child has early caries. Okay, we suggest these cream milk based cream toothpaste for a reason, because firstly, they don't have fluoride in it, but they have milk protein in it, which helps to remineralize the teeth structure. What do you mean by remineralization of the teeth structure? They help to rebuild the strength of the teeth which is lost. Okay, they don't rebuild your tooth, they just rebuild the strength of the tooth. Okay, so your milk based tooth creams can be used for kids who have initial cavitation lesions like the white spot lesions, but this is very highly contraindicated in kids who are lactose intolerant, because these are milk based. If your child is allergic to milk, this should not be used. Okay, then for children who are below 2 years of age, non-fluoridated toothpaste can be used for them. Non-fluoridated toothpaste in the markets are available in form of like Colgate, Ora Gel, Mama Earth toothpaste are wonderful because they are naturally made and they have excellent taste. So you can opt those for your children. When your child is above 3 years of age, I would recommend to start with the fluoridated toothpaste, depending upon fluoridated toothpaste. Now, the frequency of the fluoridated toothpaste, whether to use it once a day or twice a day, depends on how much cavity or how much your child is prone to cavities. So if your child falls under high risk cavity patient, then your child should brush twice with a fluoridated toothpaste. But if your child falls under low risk category, then he or she can brush with fluoridated toothpaste only once. Next slide, please. Ma'am, next slide. So these are the few fluoridated toothpaste which are available in the market. Ma'am, previous slide. Hello?
Yeah, the fluoridated toothpaste, no?
Hello? Yeah.
Yeah, Dr. Neeti, can you hear me?
Yeah, I can hear you. It's breaking. The voice is breaking in between.
Okay. Can you see the slide, fluoridated toothpaste?
Cannot see the fluoridated toothpaste ka presentation, the slide. Yeah. So these are few fluoridated toothpaste. These are the few fluoridated toothpaste which are available in the market. Okay. Again, I am saying before giving a fluoride toothpaste to your child, do take a recommendation from your pediatric dentist, because not in all cases too much, because see, anything in excess is not good for your child's teeth. So if your child is ingesting too much of fluoride into the mouth, it's not good for the oral health. So whichever toothpaste you're using, use it with the recommendation of your pediatric dentist. So now we all got to know why the caries happen, when and what all to be done. You know how to brush, what all to be done. Now, what are the precautions? What are the prevention measures? What we can take so that your child doesn't reach to that level that you have to do an invasive treatment in your child's mouth. So prevention is very important, and certain points which you can consider while consider so that prevention is done in a good manner. Ma'am, next slide. Firstly, dental visits are very important. Visit your dentist, pedodontist, for the as soon as your first teeth erupts. Okay, then post or any treatment, whether it's just a checkup or maybe it's just a follow up. Do not forget to have a dental 6 monthly dental visit, because any kind of small cavity which is newly forming in the tooth can be caught in 6 months and can be corrected. Okay, so once you visit your dentist, make sure after every 6 months get a fluoride application done for your child. Now, what is fluoride? Nowadays you might be hearing a lot of fluoride. Some of your um, colleagues, parent friends might be telling you ki my child is getting a fluoride treatment done. You also should get it done for your child. What exactly is fluoride? Ma'am, can you just explain? So fluoride is nothing but it is something which I can say it doesn't stop cavities. Okay, it doesn't stop. From the cavities to form, but it makes your teeth resistant to cavities. Okay, as in once when a fluoride is applied on your tooth, okay, when fluoride varnishes are applied on your tooth, what happens if your cavity is taking, if without fluoride your cavity, one black spot is going to take 3 months to turn into a big huge cavity. When you applied fluoride, this 3 months ka journey is prolonged to around 9 months. Okay, so it slows the process of cavitation. So when it slows the process of cavitation, your tooth which requires filling will require filling even after 6 months, and it would not go for a deeper invasive treatment. Okay, so fluoride varnish is a preventive treatment. When you dentist, make sure a thorough cleaning of your teeth is done. Post the cleaning, you can apply a fluoride varnish on your child's teeth so that your child's teeth are very well protected uh, and are caries resistant. Okay, so that's how fluoride is effective. It helps to reduce the acid attack on the teeth. So, as a parent, you can ask your child not to eat too much of junk food at wrong time. Okay, when I say not to eat, doesn't mean not to ask your child to eat junk food at all. Not to eat junk food at particular times. As I just said, mentioned earlier, snacking between the meals should be avoided. Your child can eat. I'm not saying unhealthy food. Your child can eat outside food, but in an health by following certain protocols, like as I said earlier, avoid chips, biscuits, cream or chocolates in between your meals. You can give them as in a form of dessert immediately after your lunch, and try to cut down the intake of sugar during the night time. Your child can have sugar intake during the daytime and not during the night time. What usually I recommend my patients is that if your child is too much involved in eating sweets, you can choose one particular day for your child where your child can collect chocolates given by others or in a magical box and can eat those chocolates only on one particular day, and that too during the lunchtime. So in if you make it little playful, your child will not cheat on you because of sweets, and they will make sure they collect all the sweets so that they can enjoy that one particular day with their chocolates. You can do that with them. That this change can help a lot. Then make sure you encourage your child to have a lot of milk, fibrous fruits, and vegetables, because fruits and vegetables firstly really help keep their mastication process in on point. Mastication process is basically chewing habit. So when you're giving them a fruit to bite on and to chew, it's also encourages self cleansing of the teeth. So that is a very good thing. It will help to have give them an excellent bowel movements, that is no constipation, which will help to overall develop the overall health of the child. So please encourage them to eat healthy fruits and vegetables at home, and especially in between the meals. If they are craving for eating anything, because they're hungry, give them fruits instead of giving them chocolates or chips. Don't forget to brush twice, once in the morning and once in the night. Brushing is really, really important, and uh, more than how much time to brush, make sure how do you brush. You need to move the brush in a circular manner. Can you click the screen once more? Once more? Yeah. When you brush the teeth, make sure you go in the circular manner on all the teeth, near all the teeth. Don't be aggressive while brushing, because harder you brush, the more your teeth gets cleaner is a myth. It never happens. You just have to brush in a circular manner. Your brush and your paste should reach all the corners of the teeth, and then ask your child to gargle thoroughly. Usually when you give them water to gargle, make sure you play a small game with them, or maybe make it a little playful by saying key 4 times on the left, 4 times on the right, and 4 times in front. So it's gonna be like, and then spit. So when you do that, 4 times on the left, 4 times on the right, 4 times in the front for 3 times. Make sure when they do that, they will enjoy it and they will keep counting in the mind, which will make their work very easy and faster. As I said, brushing and gargling. That should be a protocol. If your child has this habit of eating in between meals or eating while traveling, where brushing every time is not possible, or maybe gargling all the time is not possible, make sure you give a lot of water to your child after he or she eats or drinks anything, because drinking water will help them to remove all the sticky particles from the teeth, and it can be good for your teeth. If your child if your child is not okay, I also recommend at times, depending upon what case I'm recommending, at times I do recommend xylitol chewing gums for children. Okay, xylitol chewing gums are basically sugar-free chewing gums, which few kids can have, so that if they're out somewhere and gargling is not possible, and if they're eating too much of sticky food, make sure you give this chewing gum to them so that they eat all the food which is stuck in between the teeth sticks to the chewing gum, and then ask the kid to throw the chewing gum. This can be incorporated, but make sure you ask your dentist ki can we give chewing gums to our child, because it's not recommended for all the cases. So the motto is like, if you have happy healthy teeth, all your child's overall health will be healthy too. So make sure all the members in your mouth, that is your teeth, your tongue, everything is clean, and they all are happy, so that your child is happy overall. Thank you. I hope this session really helped you all to understand the basics of how the cavities form, what can be taken care of to avoid the cavities. If you guys have any doubts, you can please ask me.
Pratham, Pranav, you want to ask anything to doctor? Yeah, Pratham, Pranav,
No, ma'am. No.
you understood everything?
Yes.
Okay.
Dr. Shefali has a question on Dr. How to know that?
Yeah, so Dr. Shefali's question is, at what age can we start fluoride treatment for kids at clinic?
Ma'am, fluoride treatment can be started for kids at the clinic right from uh, 2 years of age. But at certain kids are very prone to cavities. Okay, when you see their new teeth which are erupted have incipient lesions, so as soon as you see those incipient lesions at any age, right from 1 year of age, you can start applying fluoride varnish on those particular teeth. I would not recommend that acidated fluoride gel for the kids at an early age, but I do recommend fluoride varnish for kids at early age.
Is that clear, Dr. Shefali? Okay, Pooja wants to ask, is it recommended to brush after taking medicines?
What kind of medicines are you, ma'am? Can you be more clear and specific about those? If you're talking about multivitamins, syrups, yeah, I do recommend, especially kids who are on multivitamin syrups. You clear? I'm audible, right?
You got muted in between.
Now am I audible?
Yes.
Yeah. So I'm saying a lot of kids are on multivitamin syrups. So if your kid is on multivitamin syrup, post giving the syrup, make sure you gargle the child's teeth really well, because multivitamin syrups have this zinc and iron content in them, which have a very bad habit of staining the child's teeth. So immediate brushing is really recommended for kids. Post that. I would recommend take the medicine first, then brush, and then make your child sleep. Don't brush, no brushing, then medicine, and then sleeping. No. First medicine, brushing, and then sleeping. Is it clear, Pooja ma'am?
Another question is teething home remedies
Yeah.
for
Teething
kids.
home remedies for kids. Ma'am, you can take a cube of cucumber, or maybe a big cube of carrot, freeze it, and then give your child to bite on. That is the best thing what you can give the child. Make sure if you're giving your child the cucumber, you remove the seeds and just the down part, and big enough so that your child is able to hold it in the hand and doesn't swallow it through the throat. Okay, they should chew on it, and it should be frozen in that. It should be quite frozen, because if it's frozen, it will give relief to your child from teething, and plus it's good. They'll enjoy it because it's cold.
I think one participant who's not attended, she wanted to know what is the right age for going for braces treatment.
Going for braces treatment. So a lot of what you can say, they po- mm, what I can say, a lot of problems can be easily noted with your permanent teeth placements. Either your permanent teeth can be too ahead, either they can be placed locked behind your lower teeth from at back, because sometimes your milk teeth don't fall at right time and your permanent teeth starts erupting from other side. So a lot of positional error can be seen with respect to your permanent teeth. So as soon as your permanent teeth start erupting, that is the time when you visit your pedodontist and get known whether you need braces or no. If your pedodontist feels like there certain corrections can be done with the help of braces at an early age, then braces can be started quite early. Braces can be started immediately, even as soon as your permanent teeth erupts. Your permanent sixes should come in the mouth, your permanent anterior should be present, so that braces can be put on those teeth and the correction can be done earlier. Okay, I'm not saying if early correction is done, your child may not require braces with all the permanent teeth later on. Your child may require permanent braces with all the permanent teeth later on, but it will definitely reduce the duration of the braces treatment in future.
So the one who had asked, no, her daughter is already 14 years old.
Yeah, ma'am, I saw the pictures which you had sent me on WhatsApp.
Yeah.
For her, I would recommend that she should visit her dentist firstly, get a cleanup done for herself, because there is slight crowding in her lower teeth, because of which there is yellow teeth which are present, and there is a lot of plaque accumulation on her front teeth because her front teeth are little ahead. So because of which her mouth remains open and there is lot of plaque accumulation because of mouth breathing. So she should get a thorough cleanup done for her teeth, and definitely she should visit an orthodontist and know whether her child should go for braces or not. Because if all the permanent teeth have erupted, then she can go for braces as early as possible.
How to clean child's tongue?
There are tongue cleaners which are available in the market, which we use for adults as well. If your child is more than 6 years of age, you can use those adult tongue cleaners for your child as well. If your child is less than 6 years of age, there are there is finger brush which comes, silicone finger brush, which has a tongue cleaner on the backside. So you can give those finger brushes to your child, and the backside of the finger brush has the tongue cleaner uh, serrations present. With that, your child can clean the tongue. You can also put that finger brush on your finger and clean your child's tongue. That can be done. Let me tell you, whenever you're cleaning your child's teeth, your child is surely gonna gag, because gagging is something which is their patency. So even if they are trying to do during the tongue cleaning, make sure you do clean the tongue. This is all bahanas of not brushing and not cleaning the teeth.
There was one question, are cavity varnish or liners helpful for cavity-free teeth?
Yeah, as I mentioned earlier, cavity varnish or liners are nothing but fluoride varnishes. And yes, they are recommended. They're recommended as early as possible, depending upon the child's child, how much child is prone to cavities. So yes, it is definitely beneficial and it is definitely recommended.
Neonatal tooth, should it be extracted or not in 5-year-old child? What if there's no permanent teeth beneath it?
Okay, so let me just first clear the concept of what is neonatal teeth. So some kids, when they are born either with teeth or a new teeth erupts in their mouth as by 1 month of age. So if your child is born with the teeth, the condition is called as natal teeth. If your child, if the new teeth erupts within 1 month of age, then it is called as neonatal teeth. So basically, neonatal teeth can be either extra primary teeth, primary as in extra milk teeth, or can be milk teeth itself. They cannot be permanent teeth. So they can be, if they're causing trouble, they can surely be extracted at an early age. Because if your child is less than 6 months of age, and if your child natal and neonatal teeth are moving inside the mouth, your child can aspirate it and it can go into the lungs instead of going into the stomach, because your child is still trying to learn how to swallow. Okay, they haven't learned it properly. They just know how to suck. They don't know how to swallow. So it can be it can be a problem. So it's better to get extracted. And if your child is having it till the age of 5, I won't recommend it to remove. Let your permanent teeth come and then we can remove it. They'll fall along like natural process, like a normal eruption process.
There was a question, how many times to brush?
Two times to brush. You see, frequency of brushing and pressure you apply during brushing don't really help in brushing. Okay, so it's basically how you brush that is more important, and 2 times is more than enough. If you brush 5 times, it's not going to make your teeth any cleaner. You brush twice, but make sure when you brush those 2 times you brush thoroughly.
Then there was a question, my son has a front tooth cavity problem. He has just started with a cavity. What treatment should we have to take?
Firstly, get your child immediately to the dentist. And if your child is suffering from those white lesions which I showed earlier, then those lesions can be taken care by your fluoride varnish. You don't really need to do drilling and put a cement to restore those teeth. If they are in their early stage, only fluoride varnish can be helpful. But if the cavity stage has been gone a little further, where you need to where the tooth structure is really scrapable, okay, and there is a nice depression on the tooth, then a filling would be recommended. Depending upon how bad the teeth have gone, the treatment plan would change for the kid. But obviously, prevention can be started with cavity liner, that is fluoride varnish.
Okay, so we are done with the questions. Any more questions? Shwetali ji, Pooja, Shifali.
Not from my side.
Okay, ma'am,
So this
is
session
your
was useful.
is your doubt clear, ma'am? Are your doubt clear?
Yeah, basically, I'll head for X-ray only, and then
Okay.
probably will
Yes.
identify the challenge. Okay.
Yes.
Thank you so much, Dr. Neeti. Thank
No
you,
problem,
Dr.
Shwetali
Aarti.
ji.
Most welcome. Thank you for attending, all of you. And thank you so much, Dr. Neeti, for your time and for the valuable guidance.
Yes. Thank you so much, ma'am, for keeping this session. It was really brushing of my knowledge. Plus, I was glad that I could help everyone.
Thank you so much.
So I think we can end the meeting. We'll share the recording with the participants who have missed the session.
Yeah, that we can do.
Okay, thank you. Thank
Thank
you,
you,
Pooja.
everyone.
Thank you,
Thank you.
Shefali.
Have a nice day.
Yeah. Okay. Bye.